Yeah, that's right. Rudabeh, you and I have been talking about this. I've been all over the country talking about COVID for such a long time. We really are at the two steps backward stage, it seems, because we're still talking about increasing numbers. And like you said, that doctor had something to say about the way these numbers are being reported. But first, to set the stage, I mean, I'm in California now. California is showing a 43% increase in COVID cases, 2,000 cases last week. You go to a state like Louisiana, their highest number since the beginning of the pandemic. Missouri, their third highest since January. And then, of course, there's Florida, which now is representing 20% of the cases nationwide. And like you said, Florida is one of those states, along with South Dakota, Iowa, and Nebraska, that have changed the way they're reporting these numbers. And that means that when you see these numbers, you're seeing them weekly in those states. You're not seeing them daily. And doctors, as you mentioned, Rudabeh, are talking about how important it is to see those numbers on a daily basis.
How close to capacity your hospitals are is going to make a difference as to what your local measures for mask wearing and isolation and indoor gatherings and so on and so forth is going to be.
So Dr. Humania Gubzadeh, he's with Weill Cornell in New York. He's saying that that's how they decide what these numbers look like, tell you where you are in the case. So you're looking at those hospitalizations. Without getting those numbers daily, you're not getting an accurate reflection of what things are like. But mask mandates are back, right? St. Louis, Missouri, this week is going to, tomorrow, actually, or Monday, actually, they're going to look at a whole new mask mandate for that city. You're seeing mask mandates in Las Vegas, Nevada, and here in Los Angeles, where I stand, they've had to put the mask mandates back for indoor settings. It's not something that certainly Gavin Newsom, the governor here, who's in a recall election race, wanted to do, but it's clearly decided by the numbers we're seeing. Rudabeh?